Hey, welcome everybody. As you've probably noticed, you're seeing a poll. If you don't mind answering a few of these questions, and we'll give everybody a few seconds to answer those. And since it is 10 o'clock, we can go ahead and get started. Thank you all for joining us this morning for our October Community Cafe. And the purpose of our community cafes are to have open dialogue with you guys, get some feedback from you to see if there are things that we can help support you in, any kind of feedback, any information that we can share with you, and just getting to know each other and networking. So my name is Katie Varnado. I'm one of the regional directors of our community engagement team. I serve Rutherford, Burke, and Catawba counties. And this month's Community Cafe, the topic is going to be welcoming our new counties to the partners team, and introducing our department to you so that you can put some names and faces with the folks that are going to be serving in your communities, and to hear about some of the projects and things that we've been doing in the community that we're really proud of, and to hopefully share some ideas with you and get some feedback from you guys about what ideas you have, and what kind of innovative approaches we can take together to improve lives and strengthen our communities. So I will do some quick housekeeping. My colleague Amber is going to be monitoring the chat box. So any questions you have, you can just pop them right there in the chat box, and we will make sure those are answered. You can raise your hand or ask questions at any time. This is definitely not a formal presentation. It is an open community conversation. So don't be afraid to speak up at any point during this. You're not interrupting or interfering with any kind of formal presentation. We want to have that casual coffee conversation with you. So we do offer closed captioning, and you'll see that popping up at the bottom of your screen. If that's distracting to you, you can turn that off, but it's auto-generated by Zoom. And I'm going to turn it over to Abby for a second, Abby Cole in our Marketing and Communications Department, and she's going to tell you a little bit about our interpretation services.
Okay, thanks, Katie. So we have Jeff Kilman with us today, and you may see him pop up on your screen, but what we are going to be offering is Spanish interpretation, and it will be simultaneous. So we will enable the feature through Zoom and turn that on. And so once I do that, you'll have the option at the bottom of your screen to select English or Spanish. So it's your preference, and Jeff is going to interpret that right fast with the instructions, and then I'll enable that.
Buenos días a todos. Hoy tenemos con nosotros Jeff Gilman, que va a estar proporcionando una interpretación simultánea al español, y vamos a utilizar la función de Zoom para ello, y que lo que ustedes van a ver en la parte inferior de la página es la opción de elegir o bien el inglés o el español.
All right, thank you. I'm going to go ahead and enable that now. So give us just a second. Okay, Katie.
All right, thank you both for that. So I'm going to give you a little bit of an introduction to our department. We are growing along with our organization. Partners is committed to community engagement. We believe in active participation, collaboration, and innovative approaches to achieve individualized goals within our communities. So we actively build relationships with our community partners to identify and address the tailored needs of our communities. And we pride ourselves on those relationships and customer service with our stakeholders. Our community engagement department works with our internal partners and a multitude of community partners through a variety of outreach methods to promote awareness of special populations we serve. So we work with stakeholders at all levels to provide education about Medicaid transformation, about the LME MCO, and to also serve as that connector between our community partners and our internal departments. And a lot of times we are the voice of our communities internally, and then communicating our internal processes back out to our community partners. We believe by working together and sharing resources, we can collectively create the most focused, positive impact for our members and in our communities. So we are a group of people that really enjoy community work, and most of us live in the communities that we're serving, and we're really proud of the work that we're doing. And so our fearless leader, Tara Conrad, is not able to be on the call with us this morning, but she has extensive experience with the LME MCO. She's a licensed clinical addiction specialist. She's worked on countless projects in the communities and has really served as a point of contact across our catchment area for helping us organize our department and lead our department to meet our strategic goals. And so I'm going to give her a shout out, even though she's not with us this morning. And also would like to welcome our newest team member, Shelby Holland, who is our travel liaison. And she is on the call with us. So welcome, Shelby. And we're excited to have you be part of our team and serve as that point of contact for our Native American communities for the travel liaison position.
Thank
so
you,
now,
Katie.
Oh, you're welcome. It's good to see you.
You as well.
So now what I'd like to do is turn it over to my panelists here, and they're going to tell you a little bit about the work that they do in the community, things that they're proud of, the impact that their roles and responsibilities have in the communities. And I'm going to start off with my colleague, Jeff Eads.
Good morning, everybody. And I'm going to set a timer. So if you hear a phone timer go off at 5 minutes, my time has expired. So welcome, everybody. And Katie did such a nice job with giving an overview of what we do and what we're about. And I'm specifically going to talk a little bit about what I do as a regional director of community operations for partners, and how we all work together as a team. So I started with partners in 2016 when the regional director jobs were just getting started. And the reason partners opted to form a position like the one that Katie and I have was pretty simple. But it was a simple beginning that led to some quite complicated adventures later. Essentially, partners wanted to have a point of contact in a region. And I work in Iredell, Surrey, and Yadkin counties. So the mission, if you will, was to become a point of contact and a liaison and a subject matter expert on what was going on in our system for local elected officials. And think about your sheriff's department, your boards of county commissioners, but also for county administrators like the county managers, the heads of your social services departments, school superintendents, public health directors, those types of folks. So you're kind of what I would call higher level stakeholders and community leaders. At that time, of course, our system, as you all know that are on this call, has been and continues to be in a state of transition, right? So sometimes people that are in decision-making seats have questions about, what's going on with the system and how can we work better together? And they often have needs within their own departments for training, they have needs for education, those types of things. So as a regional director, the biggest part of my job is to listen and to spend time with those individuals, not only in formal meetings, but outside of those meetings as well, to kind of form what I'll call, close close relationships with those individuals so that they can feel free to pick up the phone and call me and ask, questions that may not be the ones they want to bring up in a large formal type meeting. So then what I do with that information is I connect dots. And I think that's one of the most interesting things about my job, which is to listen, hear what a need is, and then to think about what are the resources that we have at Partners and how can I help to put some of these pieces together so that we can get to a good place in that community. One of the ways that we do that is we are very community centered. For example, some of you may have heard of person-centered thinking, where it's kind of the not about me, without me mentality. We like to take that approach and expand that to the bigger picture. So we at Partners, we don't do anything cookie cutter in our communities. So I work in a region, but each of those counties I serve individually. And so what I like to do, and like to think that we as a team do, is we like to design very specific programs to meet the individual needs of that community. I think overall, the response has been very positive to that approach. And as we have new communities that are joining us, and I'm thinking about our partners in Union, Stanley, and Cabarrus, and starting November 1, we'll have our new partners in Forsyth and Davie coming on. We just hired a regional director to serve Union, Stanley, and Cabarrus, that is Lachey Avery, and we're in the process right now of recruiting and hiring for a regional director for Forsyth and Davie. So you two will also have, again, that personal touch in the community. So again, I have a lot of enthusiasm about this. This is a great team. And of course, I'm going to put my name and number in the chat box down there. So if folks from any of the communities want to call or just text or anything like that to find out more about what we do and how we might be of help, please do so. So with that, I'll pass it off to my colleagues in community engagement, system of care. So thank you very much.
Thank you, Jeff. I'm just going to piggyback on what you said. So good morning. I'm Jamie Piercy, the System of Care Community Engagement Manager here at Partners. And today I'm honored to introduce you to the community engagement specialists who serve on the team, as well as Casey Vinsky, who is a family representative. And the view that I'm in, I can't see if you can see Casey or not right now, but I'll first start by introducing Casey. Casey's role is both new and unique to Partners. So Casey is a certified family partner. And a family partner is a parent or guardian who has lived experience with a child with emotional, mental, or behavioral health challenges. And so Casey's role is really critical. It's a critical piece in the community as she serves as the voice of children and families, assisting with navigating the system. And she's also able to assist with educating, role modeling, and providing hope for those experiencing similar things as she has been through with her own child. And I know Casey this week is at CIT, Crisis Intervention Team training for law enforcement in Gaston County. And so I want to talk about some of the education and awareness pieces of her role. Education efforts of Casey as a family representative, of course, include her participating in crisis intervention team training for first responders. During CIT training, she shares about her personal story and how to best support both children and adults who are experiencing a behavioral health crisis. In addition to that, she also assists with CFT training or child and family team training, and as well as system of care trainings. Casey is currently working with the state to develop a System of Care 101 training, which she will use to educate collaborative members as well as community-based organizations. Another portion of Casey's role is advocacy and promotion. And what she does in that is she helps to promote system of care principles on a macro level. So she promotes service access, timeliness, and quality of care for youth and families. She also participates in the collaborative meetings and other community-based meetings representing the family voice. And in addition to that, she's engaged with a variety of state system of care meetings and subcommittees. So Casey is super busy, covering currently 12 counties. And then of course, November 1st, she'll have 2 more with Davie and Forsyth. And so now I'll kind of switch gears and talk about the community engagement specialists. And I would like to introduce them as I'm talking. First and foremost, I think we have Jerry Campbell on. And so Jerry is the community engagement specialist for Yadkin, Iredell, and Surrey counties. We also have Robert Anderson on. He is the community engagement specialist for Cabarrus. Tiara Davis is on, and she is the community engagement specialist for Union and Stanley. And Shakina Pope is the community engagement specialist for Cleveland, Lincoln, and Gaston. And not to leave her out, but Carol Boston, I don't think she was able to join us this morning, again, unless she's joined since I've been talking, but she covers Burke, Catawba, and Rutherford. And we still have a vacant position for Davie and Forsyth, but we are working on it. And so the role of the community engagement specialist, I like to think the most important way to view this person is really they're the liaison between partners in the community. So community engagement specialists facilitate juvenile justice behavioral health meetings, as well as collaborative meetings within the counties they serve. But they're not just a part of those 2 meetings. Of course, they're embedded in the communities. And so each of them attend various meetings within the counties that they serve. The community engagement specialists, they engage providers, advocacy groups, and other stakeholders to understand and support community needs. So in addition to that, they participate in a wide variety of events within the counties they serve. And so you may see a community engagement specialist, out at a resource fair. You might see them at an educational event representing partners on a panel. Sometimes there's a lot of overlap between the community engagement specialist and the regional director. But I think, Jeff kind of hit on it earlier. The only difference is that regional directors really engaged with those higher level stakeholders, and community engagement specialists do as well. So, a lot of overlap. If you're not familiar with community collaboratives, I wanted to take a moment and just touch on that. Partners host community collaboratives within each county on a monthly basis. Our collaboratives are a little unique in that they include both child and adult serving agencies and stakeholders. So if you are interested in being a part of the collaborative within your county, I'll put my information in the chat and you can just email me and I'll link you to the appropriate community engagement specialist. But collaborative groups identify gaps in services, they develop partnerships with agencies, they promote resource development, they offer technical assistance, and they help to ensure high quality services are delivered within the system of care philosophy. Each of our collaboratives are very different, but they consist of community stakeholders and other behavioral health provider agencies who work together, along with families and family support organizations. And we're working really hard to get people involved who have lived experience. So as you learn from Jeff and I, and you'll hear from others, the most important aspect of our work is collaboration and engagement. By developing partnerships with community stakeholders, community-based organizations, and providers in each of the communities we serve, we are able to address issues and barriers that may be too large for any one entity to tackle. So with that, I would like to turn it over to Jerry Campbell, who would like to discuss a project that he was recently involved in, which really exemplifies the importance of the community engagement specialist role.
Good morning, all. And I think Jamie started by mentioning me first. I think that's because I'm the elder spokesman of the community engagement team, but that's okay. I own that. I would like to first welcome everybody, if you want to turn your video on. We'd love to see your smiling faces. Understand some of you may not want to, but if you're willing, we'd love to see you. And also as we go, please feel free to put your questions in the chat box and we'll try to get an answer if we don't have it with us. Jamie mentioned projects. Part of what we do is work with the community, and community, think of community as large as you want to think of it, because Jeff mentioned his role. We've got other departments internally that work in different areas, and we probably connect everybody in the community in some way, shape, or form. So whether or not it's someone that's directly getting services or an agency such as several of you or other stakeholders here, the school system, even your banks and other businesses, there's always a connection to all of those and the services we do because it touches everybody. So last year we had in the middle of COVID, one of the local United Ways that I work with put a generic email out about what if you had a little bit of money, what would you do? And it was open to a bunch of people, and I was one of the ones that responded. And what we focused on was suicide prevention. And I work internally with marketing and communication. And I work with Jeff Eads, our regional director, to explore this opportunity. Ultimately said, you know what, we need to do this. So from there, we met with the United Way and came up with some other community players that we felt like needed to be involved in this project, but we also wanted to keep it small, that way we could roll. While we were planning all this, another teenager in that particular community committed suicide. And we went into the meeting with the school system a little bit hesitant, but knowing it was truly needed based on the discussion. So after we met with them, they came on board and we discussed the aspects of what this would be. And we felt like producing some videos, but more importantly, focusing on educating the community about suicide prevention and using different training resources was going to be the focus. The initial project started out with about $8,000 in funding, and ended up, after we met with the school system, the United Way was able to secure over $30,000 in additional funding to make this work. So we started with a short 2
Katie, I'm thinking Jerry is frozen.
Okay, I was wondering if it was just me or if it was.
This is getting to be ridiculous. That was good stuff. Thank y'all, somebody, for saying something.
Yeah, or I thought maybe Jerry was doing a dramatic pause, but
Well, last month my internet went down and it was just me, so I was like, can anybody hear? And everybody could hear but me. So.
Oh, I think he's back. I think Jerry's back.
Jerry, you're on mute.
My apologies. I'm not sure what's going on. I've had some issues this morning. So I'm not sure where we left off, but after we met with the school system, the United Way ended up reaching out and getting additional money. And we ended up having 3 videos that were each 10 minutes, one geared towards youth, one geared towards parents, and one geared towards the community at large. The additional piece of that training was we were able to offer question, persuade, and refer, which is QPR. And Amber, who's on the call, was able to train approximately 30 youth in suicide prevention. And we're still working and expanding on to actually meet with the United Way tomorrow to move it forward. But Jamie had asked me to highlight one of the things that we've done that was not directly tied to our collaboratives, but it just shows the work we do in the communities and the collective impact we create. And in that role, Partners was really the backbone of a collective impact opportunity in the community. And we welcome discussion about similar things in other communities that we support. That's really what community engagement specialists do. We work with the community to figure out where there's a gap or a need, and then we pull in the right players internally and externally to serve and support. Thank you.
Thank you, Jerry. And up next, we have Casey Vinsky, our family partner that Jamie was mentioning. Casey, do you want to say a few things about your work?
I think Jamie pretty well covered it, but it's hard to tell. Me and Amber are sharing a camera, so at least it's putting a face with a name here. So yes, I'm Casey Vinsky, and I am a nationally certified parent peer support, short called family partner. So thanks for having me.
Thank you, Casey. And up next, we have Carla with our GAS team.
Thank you, Katie. My name is Carla Bradshaw. I've been with the GAS team most of the time since 2011. We have now, but with the expansion, more GAS team members, because there's a GAS team available for each county in North Carolina. The team that I work on is the team that covers Cleveland, Rutherford, Gaston, and Lincoln. And I'm the nurse for that team. The geriatric adult specialty teams were developed and funded through DHHS to provide education in relation to mental health, substance use needs of older adults. Originally, the GAS teams mostly trained in long-term care. To start with, they trained in adult care homes, family care homes, and nursing home staff. In the years since, GAS keeps expanding. According to the grant each year, they keep increasing agencies in the community that GAS services are available to. Now there are quite a number of agencies who either serve or engage with older adults that we're allowed to provide free education to. And there are CEU credits for professionals who need those when we train. At present, GAS can again train in long-term care facilities, but we also are allowed to provide presentations in senior centers, home health agencies, home care agencies, all the meals programs, the Meals on Wheels or the congregate meals staff, and also Department of Social Services staff. And in many cases, those are together under the same agency. We can do senior adult daycare staff, Veterans Affairs, law enforcement and judicial system. And we're also often asked to be involved in CIT, where Amber and Casey are today. We're sometimes asked to present on the section on dementia, and then we're also available for the mental health medication training, because each GAS team is made up of registered nurse. GAS teams also contain licensed clinicians and qualified mental health professionals. Each person on the GAS team has experience not only in mental health, but also in geriatrics. Other agencies that we can train in, law enforcement, EMS, first responders, and that includes everything from fire, rescue, all those agencies. We can present now in homeless shelters or any kind of homeless service provider. Area agencies on aging, any kind of senior living, whether it's like senior living or independent living or senior apartments, all their staff. So far as mental health providers, they've expanded GAS services to be available for psychosocial rehab centers and also wellness or recovery drop-in centers. And GAS keeps expanding. Each year that it comes out, they add more agencies in the community because currently we have an increase in the aging population, and that's projected to continue to increase as all the way through the aging of all the baby boomers. So the more that we're available to folks in the community, the more help that can be. We have presentations on almost any dementia subject. We have multiple on Alzheimer's, and then also we cover all the different dementias. We cover all the mental health subjects. We have education available on schizophrenia, depression and anxiety, and we cover specifically how that looks in the elderly. We provide education on PTSD and obsessive compulsive disorders, personality disorders, effective communication, crisis management. We do provide education on mental health medications in areas where staff medicate and need medication training. Let's see what else we got. Hoarding, signs, symptoms, and suicide prevention. The list is quite extensive, and basically any area in mental health, substance abuse, and dementia we can cover. And like I said, each county has access to a gas team, and right now we're up to 2 teams, and I'm sure that will continue to expand. Anyone in one of those agencies that has any question, I'll be glad to answer later. And thank you from the gas team.
Thank you, Carla. And up next, we have Amber Matthews from our trainers.
Thanks, Katie. I am grateful to work with all of these amazing people on our team who are continuing to work in our community and better our community. Just so you know, I'm one of the System of Care community training coordinators. We offer a variety of different trainings for the community. Most of them are free. We are currently doing a few that are monthly, and they're virtual. So if you would like to be added to the list of emails that get sent out each month with the registration links for those virtual Zoom trainings, please contact your community engagement specialist, or you can contact myself and you can be added to that list. Some of those things that we offer currently are risk and resilience, buffering toxic stress. There are 6 modules with that, and it's really focused on young people and experiencing trauma and what happens to the brain when they experience traumatic events, and what we can do to work together to reinforce their resilient skills. We also do a community resiliency model where we shift the focus from feelings and feeling words to sensations that are happening in the body. And that training also provides specific skills that we teach you all in the training to reinforce managing your own central nervous system. Another one is Darkness to Light, which is preventing child sexual abuse. We also offer domestic violence and human trafficking. We also have a Trauma 101 and Mental Health 101. As Jerry mentioned, we also have a QPR, Question, Persuade, Refer, suicide prevention that happens every month, and also a trauma-informed care. Those are on our regular rotation. We also are welcome to new ideas and seeing if you guys want to reach out and see if we can cover something more specific on a regular basis, please let us know. We do have a couple more trainings that we kind of provide on demand. We could do those for agencies or members in the community or special, churches or special events that are going on. So if you want more information or are interested in reaching out about that, please let us know. We do offer mental health first aid, youth and adult, and the adult, we also do higher education specifically. We actually were grateful and had the opportunity to do several classes at Lenore University recently to get their athletic department trained in mental health first aid with the higher education. We also do child and family team meeting with the help of Casey here, our family representative. And then another huge portion of our job, which has been mentioned several times, is offering crisis intervention team training to the law enforcement officers and first responders in our 12, almost 14 county catchment area, which is a 40-hour long week that we use experts in the community to come and talk to the officers about how best to interact with people with specific behavioral health challenges. So if you're interested in learning more about that or connecting and potentially being a speaker or instructor for part of that training, by all means, we are open and welcome to that as well. But I will put my information in the chat, and I would love to share some more information with you. Thank you. I'm going to pass it back to Katie.
Thank you, Amber. And I'm sure that you guys noticed as we're going through our different team members, we have such a diverse skill set. We have everything from nurses, counselors, trainers. We have degrees in business. Like, we have such a diverse skill set that we're able to really go out into our communities and apply those skills across a vast arena of different stakeholders and different opportunities that we see in our community. So I'm really proud to be a part of this team, and I'm gonna turn it over to you guys to see if you have any questions or anything that we can talk about. And I see Madeline Culbertson on the line here. We were just emailing yesterday, so it's nice to put a name and a face together. Thank you for joining us this morning. Well, I can tell you a little bit about some things that our regional directors have been working on, and how we came across Madeline. Your contact information is, we're working to pull together our crisis collaborative groups, which are law enforcement, EMS, our hospital systems, facility-based crisis units, providers, mobile crisis, into a collaborative to address the behavioral health crisis processes. So we've been getting together these stakeholders to form a community crisis plan, which will then go to the state. So if some of you on the call may have gotten invitations for that, or may be involved in that sort of crisis planning, but that's one of the things that the regional directors have been working on. We're also heavily involved in things like making partnerships for our stakeholders, like benchmarks and DSS partnerships, where we're working to embed therapists in our DSSs and working with benchmarks for trauma-informed clinical assessments and things like that. So we have a lot of different projects going on. And Jamie, I don't know if you guys want to talk a little bit more about some other projects that your collaborative groups have going on, and I still want to leave it open for our audience to ask questions also.
Yeah, so I'll let the community engagement specialists talk about their specific projects and what they're working on, Katie, but I did want to take an opportunity just to thank some community stakeholders and providers for joining from some of our new counties. I recognize some of the names, and so I'm happy to see you guys. I don't think I've met a lot of you. Well, I know I haven't met a lot of you face to face, but I don't even think I've had an opportunity to meet you on camera. So thank you for that. Robert, do you want to talk about, maybe start with you, and because I know Cabarrus is one of our newer counties, and just talk about what you're doing there.
So hello, everyone. So in Cabarrus County right now, what we're working on is just building those relationships with all the different community partners and stakeholders. I've been reaching out to a lot of folks in Cabarrus County just to meet and learn about what the agencies are doing. We did our second collaborative meeting last month, and right now we're just really focused on getting a vision, mission, and purpose statement for our collaborative going. Because that's really what's going to drive us into some of the projects that we're going to start doing next year. I know Cabarrus County has been very active in the past, working on trauma-informed communities, a lot with RBA, the results-based accountability. So I'm just really excited to be a part of the community and just get working on those projects. So if anyone else would like any information, I'll put my email information and phone number in the chat. Reach out to me. I'd love to connect with you, just learn more about the different agencies in Cabarrus County. I think that's it.
That is it, but it's a lot, Robert. Don't undermine your work. Tiara, are you still on? And I can't see you if you are, but if you are on, if you want to talk about kind of where you're starting in Union and Stanley, that would be awesome. She may not be on anymore, but she's pretty much doing the same thing as Robert. She's starting to reach out and introduce herself to stakeholders, community-based organizations, and providers. One thing that is different about our newer counties is that their collaboratives were previously just focused on youth. And so we're really trying to engage with adult serving agencies and get those providers to the table. So if you see Robert or Tiara's email come across, just know that they're trying to build those relationships.
Katie, could I say something?
Absolutely.
Yeah, while we're having this a couple more minutes just to talk about some opportunities, and I'm specifically thinking about some of our newer counties, and they're probably thinking, what's going on in the other counties that have been with partners for a while. See, Charlotte Reeves is on here from Surrey County's Office of Recovery, and just kind of wanted to spotlight a little bit of work that's going on in Surrey County, so folks might, again, be able to do some compare and contrast. Surrey County has a really robust Office of Recovery. I mean, that's an unusual thing to have in county government, isn't it? And so Charlotte works with those efforts along with a data analyst. They also have a director of that program. They're contracting out for post-overdose response with a provider. And they're also running transportation initiatives. They've made a large investment to be able to get folks to appointments. And they're thinking about this from a total health perspective. These could be people that need to get to appointments for treatment, but they also may have other things that they need to get to within their life to make their recovery journey work. And it's really progressive. These are unmarked vehicles that have inspirational things on them, like across the dashboard. So they're really stigma busting efforts there too. Tomorrow evening, I've got the privilege of speaking at an event that Charlotte's office is hosting along with the Rotary Club, one of the Rotary clubs in Surrey County. And we're really focusing on connecting with community leaders, especially business leaders, because this new initiative that they've got up and going is to help that county create a recovery-friendly workforce. And so working with employers, large employers in the county, around education on addiction, what it is, what it isn't, busting some myths, but also to talk about how to create a recovery community. So really thinking about how people don't get into recovery as individuals, they get into recovery through connections and being a part of a larger community. So Partners has been very involved with these efforts. It's been something that's been very organic and again, very special for that community as they've grown those efforts. But again, it's taken a lot of sharing of resources, sharing of ideas, sharing of, again, just what that looks like for that community to get there. Charlotte, I don't know if you wanted to say anything in addition to that, but I'm sure the group would love to hear your thoughts on it if you don't mind to speak up.
Absolutely, I would love to. We are making a tremendous effort. We're trying to approach it from a holistic view in every single aspect of our community. Just for an example, one thing I wanted to point out about like workplace, recovery-friendly workplaces, we're going to try to connect people directly from the criminal justice system, coming out of jail to get a job. And then some of the things that businesses might not understand is people on probation that have criminal charges, that have been in addiction for a long period of time. They have appointments to go to, they have treatment to go to. That is required, that they have to do. So, those appointments are always normally during work times. So doing little things like agreeing to let them get off for their treatment appointments and their probation appointments and their task appointments are things that, you know, maybe once the businesses are explained the way that it's set up, that they'll be more helpful in letting them work to do these things. Another thing that I wanted to share with y'all is that we have really made a big effort. This week is Red Ribbon Week. I don't know if any of you are familiar with that, but it is the largest prevention week in the country, celebrated after a death of one DEA agent who got murdered in Mexico, I think in 1985. But the DEA, our office, who is in charge of our county and also 21 other counties, has partnered with us. And we have had the school system partner with us, and we have been going out to the schools every day this week. I have done a different high school. 3,800 kids is what we've gotten to. We partner with the Rotary. We bought them cards, ribbons, pens, pencils, stickers, bracelets, and the DEA also donated several of those supplies. And our special agent in charge of our county has come up and talked to the middle school on Monday, and he's coming again to Surrey Central tomorrow to talk to 11th graders. And that school has lost a student to overdose. So they're very sensitive to it. So it's really been great. I have seen an amazing outreach of our community to get to the schools to cooperate. We've had a lot of different entities in our community involved. Even the sheriff's department came up there and, you know, brought their dogs and did a little demonstration for the kids, and they loved it. So there's just a whole lot of things that we can do, and we're just going to have to start working from, you know, every aspect, but it starts with our youth. Thank you, Jeff.
Thank you so much, Charlotte. And as you all can hear from Charlotte's tone in her voice, they have a lot of passion for this, and Charlotte and this whole group of folks there have been great partners with us, and we like to think we've been a small part of helping that be a success there. So Katie, thank you for letting me point that out.
Sure, and I'd also like to say congratulations to Jeff. We just heard that he won an innovations award through Eye2Eye. Do you want to we'll say congratulations for that project. You get to go to Pinehurst in December and receive an award.
Oh, well, thank you, but so I mean, that was a real team effort, but thank you.
Do we have any more questions from our audience members?
I have a comment. My name is Maddie, and I'm the Region 1 Community Educator with AmeriHealth Caritas. I've really enjoyed being able to join partners with your virtual community cafes and the different topics that y'all cover. I also just want to mention, I really appreciate you having the live transcript and the interpretation and making this a lot more open for folks that, you know, have different disabilities. And I think it's really great and speak different languages. So thank you. And I'm going to try to pass that on to our company with the webinars that we've been doing. I really want to encourage that so more folks can be involved. So thank you.
Thank you, and thank you for being here.
Katie, I think that Jerry is back. He may want to, he's having some technical difficulties this morning, but he may want to share about some of the work that he's doing in the counties that he covers.
I'll make an attempt, although I've heard the sirens going off around my house. Apparently somebody hit a power line or something. And actually I see a neighbor who was on the call that has left. So apparently it wasn't isolated to myself. We do a lot of stuff with the collaboratives. One of my collaboratives worked on care packages for mothers with that have infants, and newborns through the FQHC for one of the local communities, which I thought was really special. We have a current request for some equipment to allow for video production. We've done various projects to help agencies in the community with support for training that they offer. Honestly, I think if there's an interest in things of that nature, the best thing to do is to reach out to us as community engagement specialists and discuss it with us. And then we'll talk internally with partners to see who are the right people to bring on board as support mechanisms and see if we can figure it out. And if partners can't do it, one of the things I think is really kind of the backbone of what we do in community engagement is if we're not the right house, then we figure it out. And it could be it's an internal thing to partners. It could be simple things as a linkage and being a conduit from one organization to another. But that's what our role is in the community, is to figure out what the need is that someone may have and then work with them to figure it out. A great recent example is we had a provider that does high fidelity wraparound, had a parent that didn't have a cell phone. And she sent me an email, and in 30 minutes, we had 3 cell phone options. And we also had someone offering to provide coverage for it. And things like that happen on the backside, not in a collaborative meeting, I think are so important to seeing what we do in community engagement to serve the community. Sometimes I'm reaching out to my colleague, Jeff, to get ideas and support. We'll actually be talking later tomorrow about a similar type need in the community that we share. Sometimes it's connecting someone. I see Leslie on the call, connecting her with a high school who has a need for the expertise that Leslie has. Leslie, hopefully they connected to you and all. There's a thumbs up there or something.
Yeah, I reached out to her, but I never heard back from her. I might follow up today though.
Okay, I know as a principal, sometimes it can be kind of chaotic, and they've had a little bit going on recently. So I think that's what I would leave versus trying to give examples, just saying that if it fits within the behavioral health spectrum, substance use, behavioral health of any type, mental health or IDD, then reach out to us and we'll help figure it out.
Thank you, Jerry. And we are really proud of that no wrong door policy also. And we are connectors of people. So we like being connected to our communities and also helping our community members connect with each other. And Jerry, I'm going to turn it back over to you if we don't have any other questions or comments or feedback to let Jerry tell you a little bit about our next month's Community Cafe.
Sure. Thank you, Katie. So next month in November, we will be speaking about veterans and how our communities collaborate, share information, serve and support the needs of veterans. October was a little unique that this was partners kind of telling you about what community engagement is, but I really want to encourage people on the call that if you have things happening in your community that you feel might be something we could support and share to other communities, to reach out to your community engagement specialist, Jamie Piercy, Katie, Jeff, or whomever you know in this group, and let us know about it if we're not aware, because we're not aware unless someone lets us know or we're connected. So the whole goal of the community cafes is to pull you all in and to be a part of the discussion and share with the rest of the larger partners area. So please get us that information. We know there's lots of stuff going on in each unique community, and we get stronger when we share that information with the larger partners community. So thank you, Katie.
Thank you, Jerry. And again, I'd like to say welcome to our new counties, and welcome to our partners family. And also much appreciation goes to the counties that we've been able to work with all along. So thank you all for being here this morning, and I will let you get back to your Wednesday. And I hope you all have a good day and a good week.
You too. Take care.
See ya.
Thank you.
You say.